Most people imagine losing access to medical care as a rare, extreme situation, a natural disaster, a remote location, a complete system collapse. But for many people, limited access happens in much quieter ways. Appointments delayed for months, clinics too far away, insurance problems, medication shortages, emergency rooms overwhelmed, costs that force people to wait longer than they should. And the longer people wait, the more uncertainty begins to shape their decisions. That uncertainty changes behavior in ways most people don't notice immediately. Symptoms get minimized. Pain becomes normalized. People start negotiating with themselves. Maybe it'll improve on its own. Maybe it's not serious enough yet. Maybe I can wait a little longer. Sometimes that delay changes nothing. But other times, the condition quietly becomes more complicated while the person adapts psychologically to worsening symptoms. And that adaptation is one of the most dangerous parts. Because humans are remarkably good at adjusting to gradual decline. A person with worsening fatigue may slowly accept exhaustion as normal. Someone with chronic pain may stop mentioning symptoms entirely. A person struggling to breathe may reduce activity little by little until their world becomes smaller without fully realizing it. The real issue isn't always the illness itself. It's what happens when uncertainty forces people to constantly calculate whether seeking help is worth it. That calculation affects almost every decision. People delay tests, stretch medications, ignore symptoms, search online instead of seeing professionals, or attempt to manage complex conditions alone because navigating the healthcare system feels overwhelming. And over time, those patterns create something larger than a medical problem. They create cognitive exhaustion. Because limited access to care doesn't only affect the body, it affects how people think. Imagine waking up every day knowing you have symptoms you don't fully understand, but no clear path toward answers. Eventually, uncertainty becomes mentally consuming. People begin monitoring every sensation, every ache, every change in energy, and without reliable guidance, small symptoms can either feel terrifying or become dangerously easy to dismiss. That emotional instability changes decision-making. Some people become hypervigilant, others become avoidant. Both reactions are understandable, because the real issue isn't simply lack of treatment, it's lack of clarity. Medical care provides more than prescriptions or procedures. It provides orientation, someone to evaluate patterns objectively, someone to distinguish urgent problems from manageable ones, someone to reduce uncertainty. Without that structure, people are left trying to interpret their own symptoms while emotionally involved in the outcome. And humans are not naturally good at doing that calmly. There's also another consequence people rarely discuss. When access becomes difficult, people often shift from preventive care to crisis care. Small issues are ignored until they become severe enough that they can no longer be avoided. A manageable condition becomes an emergency. A mild symptom becomes debilitating. And treatment often becomes more difficult precisely because the problem was forced to progress untreated. The real issue isn't only delayed care, it's delayed understanding, and that delay changes outcomes. This is also why basic medical literacy becomes more important in environments where healthcare access is inconsistent. Not because self-diagnosis replaces professional care, it doesn't, but understanding warning signs, medication instructions, symptom progression, and when situations may be urgent can reduce dangerous delays. Even simple preparation matters. Knowing where urgent care options exist, keeping medication lists organized, understanding insurance procedures, learning how to describe symptoms clearly, having emergency contacts available. These things sound administrative, but during stressful situations, organization reduces friction, and reducing friction can change how quickly people seek help. The real issue isn't becoming independent from healthcare systems. It's becoming less vulnerable to confusion when those systems become difficult to access. Because most people are not prepared for how emotionally destabilizing medical uncertainty can become, especially when symptoms continue while answers remain delayed. And that psychological strain affects relationships, sleep, concentration, work, and overall quality of life long before a formal diagnosis ever appears. That's why access to care is about more than treatment itself. It's about reducing uncertainty early enough that people can respond rationally instead of reactively. If you'd like a structured breakdown of practical ways people prepare for periods of limited healthcare access including organization, symptom tracking, and communication strategies, there's a practical guide linked in the description. And if you value calm, educational videos focused on preparedness, medical awareness, and clearer decision-making, consider subscribing. Sometimes the hardest part of limited medical access isn't the condition itself. It's navigating uncertainty without guidance.